This Spotlight on Long-Term Care is sponsored by Game Plan Financial. Every game has a winner, every winner has a game plan. For more information, visit gameplanfinancial.com. A special 8-page consumer guide focused on long-term care insurance planning will be included in the November 2010 edition of Kiplinger's Personal Finance magazine. The guide, which is titled 3-Step Guide to Smarter Long-Term Care Planning, received support from a group of long-term care insurers that includes John Hancock, MetLife, Mutual of Omaha, and Prudential. It was prepared by the American Association for Long-Term Care Insurance as part of an industry-wide effort to prepare for Long-Term Care Awareness Month in November. According to Jesse Sloan, Executive Director of the American Association for Long-Term Care Insurance, the commitment of leading insurers working together marks a significant milestone. This effort, undertaken with their support and involvement, will create higher levels of consumer awareness at a most important time." Unquote. The November issues of Kiplinger's Personal Finance, which is read by approximately 2 million people, will be delivered to subscribers in October and will appear on newsstands around October 10th. The association will also make free reprints of the magazine available. Long-term care liability costs remain flat across most of the U.S., although a few states have experienced exceptionally high loss costs expenses, according to Aon Risk Solutions' 2010 Long-Term Care General Liability and Professional Liability Actuarial Analysis. The analysis was conducted in association with the American Healthcare Association and recorded the loss cost as a percent of the Medicaid per diem reimbursement rate, measured the frequency and severity of claims, and then calculated the overall loss cost per occupied long-term care bed. According to Dominic Colezo, Managing Director of Aon Risk Solutions Healthcare Practice, quote, "Loss cost trends directly impact the cost of commercial insurance and the cost of self-insurance. When advising leaders of long-term care facilities, we incorporate loss cost trends into an analysis of alternative approaches, looking at both the immediate and long-term impact on the overall cost of risk to structure the optimal risk financing solution." Unquote. The study found that overall, the U.S. average annual cost per bed decreased by almost $450 between 2001 and 2009. Meanwhile, the frequency rate also diminished, falling from 1.05% in 2007 to 0.94% in 2009, while the severity rate held steady at $135,000. The nationwide loss cost as a percent of the Medicare per diem reimbursement rate decreased from 4.07% in 2001 to 2.09% in 2009. However, exceptions to the national trend occurred in both West Virginia and Tennessee, where loss cost expenses increased sharply. In West Virginia, the loss cost per occupied long-term care bed increased by $2,390 between 2001 and 2009. Meanwhile, the state's average of $290,000 per claim ranked third highest nationwide, as did their loss cost as a percent of the Medicaid per diem reimbursement rate of 5.51%. Tennessee's loss cost per occupied long-term care bed ranked third highest in the U.S. at $3,070, while their average claim severity of $357,000 ranked second in the nation. Dr. Donald Berwick, head of the Centers for Medicare and Medicaid Services, recently pledged to cut medical costs without negatively affecting patients at a Medicare and Medicaid conference sponsored by America's Health Insurance Plans, or AHIP. Berwick was appointed to the position by President Obama in July and is now confronted with the challenge of implementing the new health care bill. Upon appointment, he faced opposition from Republicans who said he had extolled Britain's health care system and is in favor of imposing health care rationing. Berwick was given the position through a recess appointment, which bypasses the traditional procedure where the Senate votes on the appointment. In his speech, Berwick said he plans to reduce per capita costs of health care while improving patient care and improving care for certain groups, such as diabetics and the poor. One of his first initiatives is improving patient safety and reducing deaths due to unnecessary medical errors, a specialty he undertook while head of the Institute for Healthcare Improvement in Cambridge, Massachusetts. In addition, Berwick underscored the importance of the role insurers can play in revamping the healthcare system, but warned that those who seek to preserve the status quo will be left behind. He asked that insurers focus on cooperating with doctors and hospitals, and on changing the way healthcare is paid for and assessed for quality. For more industry spotlights, visit producersweb.com.